Hi, thank you for joining me for this presentation, An Opportunity to Expand Access, Mail-Based Syringe Distribution Using a Web-Based Model. The working title of this project is NEXT, which stands for Needle Exchange Technology. Just a little bit about myself. My name is Jamie Favero. I have over 15 years of experience in growing and managing nonprofits. I've worked at syringe exchange programs in Western Massachusetts, the South Bronx, and went on to found a syringe exchange program called Washington's Corner Project in Northern Manhattan. I later managed the Injection Drug Users Health Alliance and since then have been working as a management consultant. Before we talk about what NEXT is, let's discuss the issues that NEXT will address. Despite comprehensive laws and progressive policies, rural and suburban people who use drugs in New York State have limited access to syringes, safer drug consumption equipment, and naloxone. Overdose deaths are going up, opiate-related emergency department visits are going up, injection-related hepatitis C rates are going up. How can this be happening in a state that has a Department of Health that's so supportive of syringe exchange programs and Narcan distribution? One answer rests in the size of New York State. Upstate, people who use drugs could live hours from the nearest syringe exchange program. Yes, people who use drugs could obtain syringes at pharmacies. However, not all pharmacies or pharmacists will sell syringes, and these settings don't offer harm reduction education or support. People who use drugs may not want to obtain syringes or Narcan at their local pharmacy. Obtaining supplies through a pharmacy is not a private or anonymous act. People who use drugs, especially those whose only resources are in small towns, may avoid pharmacies for that reason. So what's the solution? And how do we help support rural and suburban people who use drugs that don't have easy access to syringe exchange programs? The answer to that question may have been answered by Tracy Helton. I first heard Tracy speak at the 2016 Harm Reduction Conference. Tracy was active in the Reddit recovery community and began using her own time and money to distribute Narcan through the mail after learning that someone had to wait 45 minutes for an ambulance to respond to an overdose call in a rural community. The simplicity of mailing drug users supplies was a revelation. Why aren't we mailing rural and suburban drug users harm reduction supplies? How do we resource and scale up the work that Tracy started? Those questions led to NEXT. Again, NEXT is a working title for this project, but stands for Needle Exchange Technology. NEXT is a new technology designed to reach geographically isolated people who use drugs. NEXT uses an online platform to provide harm reduction education, information on local resources relevant to people who use drugs, and allows them to order syringes, Narcan, and other harm reduction supplies on the internet to be sent to them through the mail. NEXT strives to mimic the experience of an in-person syringe exchange program. We recognize that in-person models of care are best for most populations, and we work to connect users with local SEPs and other available services. The objectives of NEXT are simple. It's a responsive, web-based online ordering system that will get harm reduction supplies to geographically isolated people who use drugs. We'll use a responsive interface that utilizes video, text, and chat functions to engage its users, and will be a hub of user-friendly, peer-to-peer, web-based drug user health resources. And NEXT will promote low-threshold, high-performance, web-based interventions. I also want to mention that I'm going to be using the term user in place of the term client or participant. A user is defined as someone utilizing the NEXT system. There are three huge advantages to NEXT. First, individuals can use NEXT in the comfort and privacy of their own homes. This enables us to reach people who use drugs that cannot or would not access syringes through a traditional SEP model and may be hesitant to obtain syringes or Narcan at a pharmacy. NEXT has embedded analytic tools that will enable us to track clicks and evaluate utilization data in real time and void of human error. Thirdly, NEXT is a low-cost method of syringe distribution. NEXT will not need to rent a client-specific space to house services, nor will it need a significant number of staff to operate effectively. When I was speaking to programs upstate, they talked about driving for hours to deliver syringes. One upstate program told me about driving 2 hours to drop off syringes, and the client was not at the mutually agreed upon location at the mutually agreed upon time. So along with the hour that the staff member waited for the client, this journey took 5 hours of staff time. Next uses the internet to deliver support and resources to people who live at unreasonable distances from their nearest syringe exchange program. Let's briefly go through the user experience of Next. The initial welcome page would include a brief description, age verification, and after this, the site will lay out the terms of agreement, more information about what the site will deliver, and a confidentiality statement. The information will underscore the confidentiality of the user, that Next will not provide information about its users' email, drug use history, mailing address, IP address, or any other identifying information to law enforcement. The following section invites the user to create a profile and answer questions, similar to that of a high-threshold SEP intake. We don't want to alarm a new user by asking too much information, but also want to gather data that will help customize their experience. Users will also customize their notification settings. So notification settings would be used sparingly, but could alert a user to a public health concern in their county, such as a recent jump in drug-related overdose deaths. Next would then provide the option of a click-through tutorial for how the site works. We want Next to be responsive to the user. If the user is a new heroin injector, the site will highlight safer injection practices and overdose prevention. Once a user's in the Next site, they'll have access to 3 main sections: mail-based distribution, education, and resources. Let's start with the mail-based distribution section. The most impactful feature of Next is the ability for users to order syringes, Narcan, sharps containers, and safer drug consumption supplies online. Supplies will be packed and mailed discreetly to the address provided by the user. Through an electronic agreement, Next will ensure that the user fully understands that the supplies will be delivered to the address indicated and that supplies cannot be sold, and whatever other legal disclaimers are to be determined. We won't be simply mailing drug users harm reduction supplies. Next will include a library of training videos for each supply provided through the system. Harm reduction supply videos is just one way Next will provide health education and resources. Next will create content related to safer injection, safely using drugs with others, injection-related medical concerns, safe disposal, and a host of other relevant topics. The goal of the educational modules for Next is that they're fact-based, accessible, and helpful. Whenever possible, Next will create videos highlighting leaders in the field of harm reduction or present on educational topics. New York Syringe Exchange Program staff and peers will be invited to participate in creating and being the stars of the educational videos. Next will also reach out to harm reduction doctors, leaders, and activists across the country to contribute content to the system. The resources that would show up for each individual would be based off the user's zip code, of course with the option to search resources in proximity to other zip codes. Next will work with upstate syringe exchange programs to find harm reduction friendly resources whenever possible. And in addition, Next will use a comment feature to allow users to provide feedback and reviews to other users about individual resource options. Before we move further, I want to quickly explain how Next would manage the Narcan ordering. Users of the system would need to watch a brief tutorial for how to use Narcan and answer a short quiz that would include essential messaging. An online reversal form connected to a reorder form for the Narcan will help us learn if users are reversing overdoses. Next, we'll provide a support feature such as a short accessible essay and tips and tricks. So in this case, how do I talk to my family about keeping Narcan in the house? We know that individuals can get Narcan at pharmacies now. We want to take it up a notch. We want to make sure users are trained in overdose prevention, that they know how to identify an overdose, and what to do after administering Narcan. Next is a syringe distribution hybrid. We want to provide personal touches that will make Next authentic and empowering. So one concern that a web-based system brings up is how do we connect, engage, and support users? How do we create a warm human connection? Next, we'll do this in 3 ways. We'll provide an introduction, we'll provide tour videos of syringe exchange or syringe exchanges closest to the zip code of the user. The tour will introduce the organization, what's provided, how to get to the location, and any other notable features. The site will also feature a live chat function with the opportunity for voice support. While this function will only be available during business hours in the rollout, we envision the chat function will be moderated comprehensively in the future. One compelling feature of a web-based system is that we can track utilization through clicks. Next, we'll be able to produce reports without costly time-consuming data entry. This means we'll have web-based data analytics available in real time, the ability to learn more about system users through periodic questionnaires, intake updates, and quizzes designed to be fun and informative for the user, and an opportunity to direct in-person syringe exchange program services to zip codes or counties with high utilization. Many people have questioned, is sending syringes through the mail legal? It is. We can purchase syringes off the internet through Amazon, medical supply stores, and other online marketplaces. We still have some legal questions about New York State public health law, but a legal review is woven into our rollout timeline. So, how will we reach people who use drugs in the first place, and who will use the next system? We know through Tracy that people in New York State are already using mail-based distribution on a small scale. We can invite these individuals to be users of the system and provide incentives to drive participant recruitment. We'll also work with upstate staff and peers to promote the site amongst users that are geographically isolated or otherwise difficult to reach. We'll work with online forums, chat rooms, and communities such as Reddit, Craigslist, and Blue Light, and we'll also be asking beta users how the site can attract more users. Last but certainly not least, we'll be using targeted Google ads within specific zip codes. Next, let's discuss the timeline rollout. So, the project timeline begins when funding is secured and the project management position can begin executing the work plan. Our first goal is to knock out any remaining legal issues as well as develop a legal framework for operating a mail-based distribution model. This includes developing disclaimers and terms of use. Month 1 will also be heavily based on networking and outreach, not only to syringe exchange programs upstate, but also to organizations like Harm Reduction Coalition, who currently have a library of training materials, educational resources, and webinars. Content creation will begin during month 2, and we'll also expect to have our web developer chosen and have completed the contracting process. Months 3, 4, and 5 will be focused on content creation, beta web design approval, video production, and resource library building. Month 5 will be completing the final steps of the minimum viable product rollout, including connecting and collaborating with programs to get out marketing materials, finalizing Google Ads, and finishing up details of a respondent-driven incentive pilot designed to connect networks of drug users to the system. The post-go-live period will include, hopefully, order processing, data collection, chat and phone support, and working to continue building out the system. In the last slide, I mentioned minimum viable product, or MVP. Minimum viable product is a developmental technique that focuses on creating a new product, in this case a website. It focuses on creating it with sufficient features to satisfy early adopters. The final features are developed after considering feedback from initial users. I think this is an excellent framework for Next. We want the system to grow to meet the demands and the needs of the population. So we're looking at Next as a pilot. What will we learn from the pilot phase? We'll learn if people who use drugs will utilize a web-based ordering system, and if the web-only product will reach users who primarily access the internet on smartphones. We'll learn how much functionality we can squeeze into a minimum viable product system, and we expect to find out if there's any capability for Next to provide services to people who use drugs who do not have internet access but want to order supplies through text messaging. Next, we'll assess if users or foundations will support the services through donations or grants, respectively, and we'll also learn how much users are willing to provide beta testing, feedback, suggestions, and requests. The Year 1 budget for Next is $150,000. The majority of the costs are related to personnel, specifically project management. Project management is full-time, and this will enable Next to deliver an MVP live system by month 6. The preceding months will focus on increasing content and functionality, strengthening marketing, as well as outreach. The budget assumes the generous support of the New York State Department of Health through granting it pilot status. We haven't built in costs related to harm reduction supplies or Narcan because we want to work with New York State and AMFAR to receive these supplies at no cost. Apps are also not included in this initial year one budget because building an app could double the budget and production costs alone. Building a decent app costs a lot of money. The year one budget focuses on building a website that can be scaled to fit a smartphone or tablet, with the understanding that many young people use phones to access the internet. Building an app is a top goal of Next, but first we're looking for proof of concept. Once we can prove that Next is a functional system and that it will be utilized by people who use drugs in geographically isolated parts of the state, we will have a better platform to fundraise for building an app. So Next is currently a vision. It's very well thought out, mindful, and intentional vision, but it's a vision nonetheless. We need funding to make Next happen. With Next, we're going to change the game for rural and suburban people who use drugs. We're going to move the needle on health disparities in rural communities. We're going to prevent disease transmission. We're going to keep people alive. The internet is changing the face of everything from communication to healthcare. Next, we'll harness the power of the internet to bring the strength and the support of the harm reduction community into the homes of people who use drugs. The next pilot phase is designed to show proof of concept. From there, who knows how far this project could reach. Well, thank you for joining me on this presentation. This is my contact information, and I'm looking forward to hearing your thoughts and questions. Thanks so much.